Every day in Minnesota, someone is in crisis and they are picking up the phone to ask for help. We recently showed you how mobile crisis response teams are answering those calls, including from people thinking about suicide. Those life-saving services are supposed to be accessible to everyone.
But Fox 9 investigator Nathan O'Neal found out if you live in Ramsey County, you could get stuck with a bill in what turns out to be a costly crisis.
It's a billing policy few people are even aware of. Ramsey County charging people in crisis after calling for help, some of them in mental distress and even suicidal. And we've learned the county has been billing people for years, a practice that mental health advocates say undermines everything. It's supposed to be a lifeline.
I think it's unconscionable.
Helping people in crisis.
Absolutely makes no sense.
But in Ramsey County, it comes with a price.
Lives will be lost. That's my fear.
Why did you want to share your story?
You know, it's not about me getting the bill myself. It's literally about the fear that somebody won't call in the future.
Adam Hated is doing his best to balance the stresses of life, work, and his mental health.
I got really depressed. Really, like, I'm getting to the end of my line here.
In a recent interview, he recalled one day in January when he was on the brink and contemplated suicide.
I felt that I'm not going to make it.
I mean, he says, Mom, I need help.
And I started crying.
He says, Mom, I can't do this anymore. I can't go on.
I locked myself in my house.
And I could tell in his voice
I didn't have a way out.
That he was in crisis.
I was honestly scared about if I was going to be alive in March. I'll just flat out say it.
A family friend called the Ramsey County Crisis Hotline, seeking help from the mobile crisis team, which provides on-site mental health services. How are you doing now?
Now I'm doing 100% better.
But months after that call for help, Adam got this in the mail.
I was very surprised when I saw this.
It was a bill from Ramsey County Social Services for $342, charging him for crisis intervention services plus travel time. Did they ever tell you that there would be a bill?
No, absolutely not.
A check of the county's website makes no mention of any cost when calling the crisis hotline. But records obtained by the Fox 9 investigators through a public records request reveal over the past 3 years, Ramsey County has billed more than $1.1 million for mobile crisis intervention services. The county billing insurance providers, but also patients like Adam.
Lives will be lost. That's my fear. My fear is that if people are afraid to call, and they don't, and they choose when, people will lose lives.
The Fox 9 investigators interviewed mental health experts, advocates, and stakeholders, all stunned to learn Ramsey County is billing people in crisis. Have you ever heard of anything like that?
I have not.
I never have, and I think it's totally wrong to bill the individual.
It shouldn't be that way.
If the other counties don't charge and Ramsey County charges, well then what's wrong with that picture? I mean, really, what's wrong with that picture? That's terrible. And they should be ashamed of it.
In fact, neighboring Dakota, Washington, and Hennepin counties all do not charge patients directly. Will individuals who need those services get billed?
Oh, absolutely not. So there is no co-pays, there is no out-of-pocket. The county or these resources will bill insurance where we can, but there's no cost to residents.
411 there are 412 people.
And in Minneapolis, we recently rode along with the Behavioral Crisis Response Team. They serve the state's largest city, and it's free to the public, no billing involved.
I can't imagine having to do that if we had to.
Ramsey County refused to give us an interview, but they did give us a lot of different reasons why they're charging people in crisis. At first, Ramsey County said federal law required it, but we found out that's not true. Then the county said the state grants that help fund these mobile crisis teams required them to bill patients directly. But we checked with the state, and that wasn't true either.
That grant money is to be used for people who are uninsured or underinsured or simply can't pay. And so, you know, to say then you're going to bill the individual directly absolutely makes no sense. And it really is not in the spirit of the law at all.
Ramsey County said, quote, there usually is an understanding by the public that there will be costs, and pointed us to the most recent fee schedule published online. But we checked. And nowhere in this 83-page document does a fee for crisis intervention appear.
No one ever told us about a bill.
The county continues to justify its billing practices, now saying that federal law simply allows them to charge, and that it's, quote, the only way to make sure this service is sustainable.
As someone who has worked on this issue for decades, we never ever intended for the individual to be charged for a mobile crisis service and for crisis stabilization.
But Adam and his family worry a costly crisis in Ramsey County could end with more than just a bill.
So I think if people knew that there's a cost to it, I think it might be a deterrent for them to actually get help.
I believe at least one life will be lost if it's not changed.
We are also checking with Ramsey County commissioners to find out where this billing practice came from and whether it's backed by the board. For the Fox 9 Investigators, I'm Nathan O'Neal.
And if you or somebody you know is suffering a mental health crisis, you can call the National Suicide and Crisis Lifeline. That number is on your screen, 988.